Let's make medical coding and medical billing fun. My name is Will from PCG Software. In the next couple of minutes, I'm going to show you how to build a system in place that'll help you increase your approval rates, your compliance, speed of payment, and even allow you to audit yourself for your providers and groups every 90 days. Let's go ahead and jump into it. So who's going to benefit from this video? Billers and coders, RCM companies, provider relations and contracting, as well as billing and coding consultants. Bookmark this. This can become your Bible and your system on how to get more approvals and faster billing. We have to start with what denials are, what impact they have on the profitability of your organization so that you can use metrics to see if you are making an impact. First, we need to know that denial rates are out of control. 10% in 2020, they grew to almost 12% in 2023. And really to be a profitable clinic right now, you need to have 8% or lower. Every time you get a denial, that's a $40 administrative fee per appeal. Did you know that? Take the number of denials you had last month, multiply it by 40, you just lost that much money by not having a system in place. Secondly, $19 billion is spent every year on people, time, and software to submit, review, and adjudicate claims. That's crazy. So if we can find a solution that helps everybody, we can reduce the cost of healthcare. There is a horrible ratio of new coders. We need new coders like crazy. So get your certifications and get out into the field. But then you're going to be managing roughly about 7 doctors. And if each doctor sees 20 patients a day, that's 140 claims. That's a lot of claims for you to go ahead and review each day. 100,000 possible codes and new changes coming in there. You need an AI medical coding scrubber like IVE Coder. You need a system like this in place. Where's it going to have the biggest impact from a payer perspective? When you're billing claims, it's mostly going to have an impact on your Medicare, MA plans, Medicaid, and managed Medicaid. If we look at how to improve the system, it's not just software, it's people and training. Insufficient documentation is the #1 reason for improper payments by payers, but incorrect coding by doctors and clinics and RCM companies. So you need to train your team on your software. You need to train them on coding, and a little review that never hurts. Okay, your EMR softwares likely are not going to be updated regularly. You can import and install a version of IVE Coder into your software. If you're interested, let me know. Otherwise, the standalone software IVE Coder will help you with incorrect coding and address things like family practices in internal medicine when you're talking about Part B and E&M codes have almost 14 and almost 13% error rates respectively. That's crazy. That's way too high, folks. You definitely need a system in place to help you with that. No matter what specialty you are, take a good look at 99214 and 204. Any initial versus follow-up consultation, they're the most problematic in America. In fact, 214 was billed over 98 million times last year. If you run telehealth, look at 99442 and 99443. They're the 4th and 7th biggest error rate in the nation right now. So you're probably asking, Will, just get to it. How do I do this? First of all, why don't you go to your billing software. Run a denial report for 12 months. When you get done, come back. All right, pause the video. Then you're going to take that report and you're essentially going to create 2 of them. Okay? The first one is your top 5 most denied codes. And these are the ones you're going to run through the system you're just about to see and try to get improvements in the first 90 days. The second report you're going to do is, what is your most billed codes? Because once you know those, you can then run it through our software to find out if you're getting paid at 100, 120% to Medicare. You want to make sure that every code that you bill for is profitable. Because remember, it's not just a one in, one out. You got to provide care. So the best way to increase profitability for your clinic, your hospital, your organization is to get paid more for the same things you're doing every single day. And the next one is obviously get IVE Coder. It is effective, it's cost effective as well, and it's easy to operate. And then lastly, use our denial improvement worksheet. So I'm about to jump right into that. Those are your 5 steps. Let's go ahead and look at implementing the program. All right, everyone, I am super stoked to show you this. I wish I had this worksheet when I was running the RCM agency. We would have impacted the lives of providers and employees so much more. Let me just jump into it. So really what it is every quarter you're actually going to record information and show the improvements of your services by increasing their approval rates, by looking at specific codes. So let me show you how it works. And there's a scoreboard. I'm going to show you that at the last portion. The first thing you're going to do is you're going to put all of your doctor's names in here, okay? And then if you're a consultant, you'll run different company names so that you can go ahead and quickly, filter this through companies or locations. All you have to do is plug in the date. So I plug in January 1st, and then I plug in March 31st, and that was in Q1. This will populate and tell you how many working days you had, okay? Then you're going to do those 5 codes that are most impactful to the doctor. What did they get the most amount of denials for? And that's your focus on. So when you're going to run, if you find it was a 99, 214, and 204, every time you're about to submit that claim, quickly run that through IVE Coder and just see if you have that code with all the additional codes. Will it likely fly? Okay? So then you're going to run that report, and you're going to make sure that you put in how many denied claims they had. So Dr. John Davis had 140 denials. You're going to see it's already going to populate. You're only filling out the stuff that is in the pink right here. Okay? So it'll tell me that I got 1.6 denials per day in Q1. And at $40 an appeal for the administrative cost, we spent $5,600 just appealing. Okay, so if you're an RCM agency, this is huge. You're costing your client $5,600. If you're a medical biller or medical coder, you need to know what your liability is. Okay, but now you can show your improvements. So watch what happens in Q2. I go to the same doctor. In Q2, we went to 120, right? Got the same codes in here. We now went down to 1.3. You can see this number's lower. Q3 and then Q4. All you have to do is record this per doctor that you want to make an impact on. Now, watch what happens in the savings scorecard. We have Dr. John Davis. You do not have to put anything on this page. For this doctor, we initially costed them $5,600 with just appeals, and by the end of the year, we took it down to $2,800. They went from 140 to 70 denials by the end of the year. We improved them by 50%. That's huge, folks. You can sell this all day long, whether you are a consultant, a paid employee, provider relations, so on and so forth. You can even break it down to how many denials per day. You went from 1.6 to less than a denial a day. And you can see the savings we saved them each quarter by utilizing IVE Coder and then running these reports. So this is big, big stuff now. Imagine if you had all your doctors listed in here. You did all of this for Q1, Q2, Q3, Q4, and you listed all the information in here, all the denied claims, all of the notes. You go back to your scorecard and you say, okay, for your 50 doctors, here's what we did. We saved you $482,000, 521. Okay, this year in just administrative costs for denials alone. That's huge, folks. That's huge. Each doctor has their savings that you apply. In fact, Q1, we cost about $629,000 in appeals alone. By the end of the year, we're down to 146. And when you look at the total amount of denials for your 50 doctors, I went from 15,000 plus to 3,600. I reduced that by 76%. Okay? So then I can also say, look, at each one of these doctors, pull up any doctor you want to, and I'll tell you the impact we had on them. Then you can say, I'll tell you the impact we had on any particular doctor, but here's the savings, 368, 49, and now we're 64. This dashboard right here not only works for client retention, or retention of your position if you're a medical coder or a medical biller, but from the business standpoint, you could sell that you were saving just 50 doctors almost $500,000 in administrative fees alone. I'm going to tell you, this worksheet is gold. So if you utilize this in combination with our IVE Coder, you can take your business or your position to the next level. Okay, so pretty much everybody in medical billing has heard of medical scrubbers, but this goes beyond that. So IVE Coder, Virtual Auth Tech, they enable you to actually look at what are you getting paid per code. So after you find the top 5 to 10 codes that you're billing the most, what I suggest is just go into here, and obviously you can go into code lists and search by HCPCS, but I usually just start from the adjudication and I hit the search. Now, we all know that this is amazing to give you descriptions. The first thing that I would do is I would go in here and I would copy this description and I would update it within my medical notes so that I'm more compliant with CMS and AMA guidelines. But you may have to look at that from a contracting level on what each particular payer wants. But that is one suggestion. But let's look at the financial details. Okay, diving in here. If I know that 99213 is one of my top 5 most billed codes, I'm going to look at, Here's what CMS pays at 100%. Okay, you can see down here it says show CMS payment at 100%. CMS would pay a non-facility at 89.44 within my GPCI. So I just set it at Virginia. You can change it, okay? And I have a 64.22 in Virginia for facility rate, okay? Now, if I find that I'm getting paid less, I don't go to my payer and I start complaining that I'm getting paid less than 100% to CMS. I can just go into my calculator and I prepare myself. I say, okay, now, am I profitable? It will adjust in here. So this is your adjusted payment at 110%. So is that profitable for you guys? Non-facility for facility. You need to find that magic number for you guys and what your operating costs are. But then I would go to my payer with 5 specific codes and say I would like to have a meeting to discuss my contract with 5 specific HCPCS codes. Okay? You can even give them the codes that you'd like to discuss. And then you can even show your screen. You could take snapshots of this and say, hey, I'm not asking for you guys to pay me back pay for 3 years of underpaying me per CMS 100%. All I'm asking is that within the next 30 to 90 days, you write an amendment, and we go ahead and agree that I get changed from my rate, which was below 100 CMS, to what is actually profitable for me, 98.38 and 70.64. That's all you got to do, folks. You are much more likely to get an approval of this in an amendment and to actually get paid a profitable rate for your codes than if you were just to complain about it and say, I need an increase. Okay, so you can use IVE Coder and Virtual Auth-Tech to look at this. So this is beyond a code lookup tool. Yes, will it help you improve your administrative costs? Absolutely. Will it increase your approvals? Yes. Will you get paid faster? Yes. But also, remember, you can only do so many claims. So one of the ways to improve your profitability is to get paid more per code. And this is a great contracting module that you guys can utilize to prepare yourself for those big meetings.